Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Morisky Medication Adherence Scale assesses patient adherence to prescribed pharmacotherapy. It evaluates behaviors related to medication taking, including forgetfulness, carelessness, and intentional discontinuation. The main purpose is to identify patients at risk of poor adherence in chronic conditions such as hypertension, diabetes mellitus, and cardiovascular disease. This information aids healthcare providers in optimizing treatment plans and improving clinical outcomes. The scale is widely validated and used in both clinical practice and research settings. The Morisky Medication Adherence Scale is indicated primarily for patients with chronic conditions requiring long-term pharmacotherapy, such as hypertension, diabetes, and cardiovascular diseases. It is most useful in outpatient settings where medication adherence directly impacts disease control and clinical outcomes. The scale facilitates identification of non-adherence patterns in populations with multiple comorbidities and complex medication regimens. Its application supports healthcare providers in tailoring interventions to improve adherence and reduce hospital readmissions. The Morisky Medication Adherence Scale consists of 8 items designed to assess patient adherence to prescribed medication regimens. Each item is a question related to medication-taking behavior, including forgetfulness, carelessness, stopping medication when feeling better or worse, and other adherence barriers. 7 items require dichotomous yes or no responses, while the 8th item uses a 5-point Likert scale ranging from never to always. Scoring assigns 1 point for negative adherence behaviors on the yes or no items, with the Likert item scored from 0 to 4, reflecting increasing non-adherence. Total scores range from 0 to 8, with a higher score indicating lower adherence. Scores of 0 represent high adherence, scores from 1 to 2 indicate medium adherence, and scores of 3 or higher suggest low adherence. The instrument allows identification of specific adherence behaviors and quantifies the overall adherence level for clinical and research applications. The Morisky Medication Adherence Scale demonstrates variable sensitivity and specificity depending on the population and condition studied. Sensitivity reflects the ability of the scale to correctly identify patients who are non-adherent to their medication regimen. Specificity indicates how well the scale identifies patients who are adherent. In one study involving hypertensive patients, the scale showed a sensitivity of approximately 0.85, meaning it correctly detected 85% of non-adherent individuals. The specificity in the same study was around 0.7, indicating it accurately classified 70% of adherent patients. These metrics imply that in clinical practice, the scale is more effective at ruling in non-adherence than ruling it out. High sensitivity ensures most patients who fail to take medications are identified, prompting further intervention. However, moderate specificity means some adherent patients may be misclassified, potentially leading to unnecessary adherence counseling. Developed in the early 1990s by Donald Morisky and colleagues, the Morisky Medication Adherence Scale was designed to provide a standardized self-report measure of patients' adherence to prescribed medication regimens. The original 4-item scale demonstrated satisfactory internal consistency, with a Cronbach's alpha coefficient of approximately 0.59 in initial studies involving hypertensive patients. Subsequent validation efforts expanded the instrument to an 8-item version, which improved reliability metrics, achieving alpha coefficients ranging from 0.73 to 0.85 across diverse patient populations, including those with hypertension, diabetes, and cardiovascular diseases. construct validity was supported by significant correlations between scale scores and objective adherence measures such as pharmacy refill records, electronic monitoring devices, and biochemical assays. Predictive validity has been documented through robust associations between higher adherence scores and improved clinical outcomes, including better blood pressure control and glycemic management. Cross-cultural validations have further confirmed the scale's applicability in multiple languages and healthcare settings worldwide, establishing its utility as a reliable and valid tool for assessing medication adherence in both research and clinical practice contexts. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.